All right. Thank you for joining me for my balance workshop, Simple Ways to Improve Your Balance and Stay Safely at Home. My name is Dr. Monica Tillett. I am a doctor of physical therapy and the owner of New Direction Rehabilitation and Wellness. And it's really important for me to talk about balance because working with seniors, I see how much balance affects their life and affects their ability to live at home independently. And every single person that I see, whether they're in their home or living with family or even living in a facility, their primary concern is maintaining their independence, continuing to do what they love. And if they are at home, then their primary goal is to be able to stay at home. So I like to do a lot of balance education. All right. So a little bit of background about me professionally is I have been a physical therapist for 14 years, specializing in geriatric physical therapy. I obtained my master's degree from Winston-Salem State University, and then went on to get my doctorate degree in physical therapy from A.T. Still University in Arizona, which is part of the Arizona School of Medicine. I have experience in working in home care, skilled nursing facilities, and also independent and assisted living facilities. And I started my company in 2019. So even though I've been a therapist for 14 years, my practice has only been up and running since 2019. And I started it because in working in the facilities and working at home, I saw that there was a gap between those clients who were discharged from home to go to the outpatient clinics, but they didn't get to the outpatient clinics either because they, one, didn't have transportation to go, or two, maybe they didn't feel comfortable or actually have the actual physical ability to go to an outpatient clinic, or three, there are just some people who prefer to get their services at home. So with my company being an outpatient clinic, I am able to help clients in their home, whether they're homebound or not. And I love that because it allows me to hit all three of those facets of why people need treatment at home. We do provide not just physical therapy services, but we provide occupational therapy and speech therapy. And as I stated before, our overall goal with all we do as therapists, PT, OT, speech therapists, our goal is to get you on an individualized program to keep you safe, to keep you independent, and to keep you functioning in your home environment, wherever that may be. And balance and fall prevention training, pain management, and it all comes together. Everything comes together with balance to help maintain independence. So tonight, the purpose is to teach you why balance and fall prevention is so important, and also allow you to know some of the facts about the impact of falls, and to give you some prevention tips, because sometimes we don't do better because we don't know better. And I know falls may be something that you hear a lot, or balance, or aging in place safely. Those are terms that we're hearing a lot of. However, there are specific things that go into it, and it's more than just one thing. And so we're going to get into all of that. But just some facts about falls is that, over the age of 65, they are seeing 1 in every 4 adults fall. They're seeing that the emergency rooms are getting an influx of falls, and it's the most common cause of what you're seeing, or what they're seeing in the emergency rooms, of fatal and non-fatal injuries. And they're also seeing that, it's a high cost, a high burden on the healthcare system with, so far these stats were only updated to 2015, but, at that time, they saw $50 billion being paid towards fall related injuries, with Medicare and Medicaid footing about 75% of that bill. So what does that mean? That means that it's our seniors, a lot of our seniors falling. And by 2030, they're expecting that cost to rise to over $101 billion. And the CDC has, actually updated a little bit of this data. But in 2019, they were able to document that 34,000 older adults fell, and there was approximately 3 million emergency room visits due to falls. So it's a major problem, and it's something that can be not 100% fixed, but there's things that we can do to help make you better, help make your balance better, and help you function a little bit more independently when you're up on your feet. So a fall, I have this conversation a lot with my clients, and whenever I ask them, upon our initial phone conversation or initial evaluation, have you fallen in the past year? That's a question I like to ask. And most of them will say, yes, I've fallen such and such times, or no, I haven't actually fallen. I've stumbled a few times, but I haven't actually fallen. Well, a fall is not just defined as the event of you going from a standing position to you falling on the floor or falling on the ground. But if you are going from point A to point B, and anything unplanned or unexpected happens that causes you to lose contact with your current supporting surface, which is your feet on the floor, you maintaining upright position, and you like maybe stumbling and hitting the wall with your elbow, or maybe you were able to correct yourself before you hit any other contact surface, that is still considered a fall. What they do not consider in the realm or definition of a fall is if you go from one position to another because of a medical event, like a heart attack, fainting, maybe your blood pressure got really, really low and it caused you to, kind of black out. And then that's how you fell. Or maybe someone pushed up against you or shoved up against you, and that caused you to lose your balance. Anything like that, they're not really considering a fall. But if it's just you and there's factors related to why you fall, maybe your foot got caught, or your balance just isn't good, then that is what they are considering a fall. So when it comes to learning what actually contributes to a fall, I like to let people know it's not just about doing balance exercises. It's not just about doing strengthening exercises. How your environment is laid out, the medications that you have, your vision, particular medical conditions, and even down to what you're using to walk and how fast you're walking, if we're hurrying, or even incontinence. And for those who don't know what incontinence is, that is you not being able to make it to the bathroom in time. And so maybe you have an episode where you release urine, or defecation on your way to the bathroom. And so believe it or not, there are instances when that does happen, and people trip on their urine. So there are many things, and we're going to go into each of these situations individually. So our environment, that means, not just where we are living. It could be the places that we travel to out in the community. But most of the time, because we are in our homes more times than we are actually out, then this is where a lot of the falls do occur. Do you have adequate lighting in your home? Is there a lot of clutter? And I don't mean like trash on the floor. It could be something as maybe you have 5 ottomans and, you know, all this furniture in your living room that you have to negotiate around and go in between. That's clutter as well. Throw rugs, as you can see in these pictures, throw rugs often catch people up. They're pretty, they're decorative, but our feet can get caught in them. But then also, if you're using a walker or a cane, those things can catch on the edge of those rugs as well and cause you to fall. Stepping over cords, as you can also see in that picture, that will cause a fall. Slippery surfaces, so hardwood floors, maybe you're wearing socks, nothing with traction on them, that could cause you to fall. If you're wearing bedroom slippers, like this particular picture with the red bedroom slippers, our feet isn't secure, and that can cause you to fall. But there may be, some maintenance that needs to be done on the floors. Is the tile cracked? Is the wooden surface, is that, chipped a little bit and it's catching on your shoes when you're walking, or your socks? Is the carpet frayed? And, sometimes depending on the amount of fray, that can catch us up as well. Medications, blood pressure medications, depression, anxiety, meds, antihistamines, any type of sleep aids, and narcotics such as like pain medication. Those things can affect some people adversely and cause them to be dizzy and have falls. However, taking 4 or more medications actually puts you at risk for falls also, because you have all these medications interacting in your system. And then if you have had a new medication added to your regimen or even removed, just your body getting adjusted to that particular medication can also cause incidences of falls. High blood pressure, low blood pressure, Meniere's disease, any type of ear infections, anxiety, macular degeneration, Parkinson's, and other neurological disorders such as vertigo or just plain dizziness, whether it's from, a medication issue or dehydration, and diabetes. All of these things are medical conditions where I have seen contribute to a fall. So again, it's not one thing. It's so many facets. And as a healthcare professional that specializes in balance and falls, then I look at all of these things when I am doing an assessment for a fall. Also, the physical conditions is what we hear most about. We hear about the muscle weakness, the pain. Our vestibular system is our balance system, and it's located inside of your inner ear. And sometimes that system slows down, especially as we get older, because it's activated by how much we move, is activated by the directions that we move, turning our heads, standing up and down, different things like that. And if we're not activating that system enough, it slows down. So that's a condition that I often run into. Or if people are having problems walking, whether or not it's because of coordination, or it's because of the muscle weakness or pain that we're talking about, it could be something like hammer toes, anything that's causing you to have problems walking, then these are what I consider physical conditions that need to be addressed in order to help your balance. An assistive device is something that assists you in walking. And as you can see here, there are different assistive devices that clients use to walk, but not every device is appropriate for that person using that device. And in the order of needing, the person that needs the most help to the person that needs the least help, that's how I've categorized the pictures here. You have the walker without the wheels, then the walker with the 2 wheels in the front. The 4-wheel walker is often a popular walker, but it's not appropriate for everyone, even though it has a very convenient seat for people to sit and rest on. Not everyone can handle the control of that walker with the 4 wheels. And then we have the short base quad cane, where you see the 4 prongs out on the end of that cane, and then our single point cane, which you may see mostly. But as I'm seeing people use these devices, is either one, they're using one that is too advanced for them at this particular level, or 2, they're carrying it with them. They have it in their hands, they have it picked up, but it's not the legs of that walker or the cane isn't actually touching the floor the way it needs to be able to provide that stability to them. So simple changes that you can make in your environment and with your physical body to help improve your balance are here. Just a few things. We talked about lighting. So if you don't have adequate lighting, so like, brightness, sometimes during the day, I know where my home is positioned, I don't get enough light in here, even if it's bright and sunny outside. And I hate that because I'd love to have the sun shine in, but in so many instances, I need to turn the lights on the inside, even though it's daytime. But if you are in one of those situations, or maybe you're in a home that doesn't have a lot of ceiling lights, then you may need to just add some extra lamps, or maybe have night lights for the evening, something that's going to allow you to visually look at your environment, see what's in your path, and stay safe. Because believe it or not, vision is about 10% of our balance. And, if you're adding in muscle weakness, coordination problems, dizziness, and then you got vision, that's about 10% of your balance, those are a lot of things going against you. The throw rugs we talked about, you want to either remove them completely, or there is double-sided tape that you can get, from Lowe's, Home Depot, and you can put it underneath the rug, and you can help secure that rug down. So when the walker goes over it, or your feet go over it, they don't snag the edge of that rug. Also, decreasing distractions can be another way to help, decrease your risk for falls in your home. And that could be the noise level in your home. Is your TV on full blast, and you got the radio on? Or it could be our little furry friends. Our dogs, when we get up, they like to walk around our feet. So being extra careful with them, and maybe trying to make sure that they don't walk around your feet when you're up walking. Those are the type of distractions that I'm talking about. If you have stairs, whether inside your home or outside your home to get into your home, then handrails is very, very important to have. It gives you just a little something extra to hold on to help you negotiate those steps. And then as far as the bathroom, having those non-slip rugs and grab bars to help you transition in and out of the shower is super helpful too. Adequate footwear, super important. You want shoes that are not going to wiggle on your feet. So if you don't have those type of supportive shoes, then wearing non-slip socks that have the little grippies are good to wear, and it will allow your feet to be able to firmly contact the surface of the floor without moving too much. So think about that. I also have, I can't wear bedroom slippers. I can't wear them. There's some that I can that fit snugly around the back of my heel and they don't come off my feet. Those I can wear, but like the little thin ones that you like put your feet into, they're not good because they cause you to drag your feet more. And if you're already dragging your feet, you don't need something that's going to make you drag them even more. So I recommend to clients having a indoor pair of shoes. So if you don't have those really good bedroom slippers that fit snugly around the heel, then I would recommend having a pair of inside shoes. And fixing any type of flooring issues, decluttering your environment. So maybe not having so many things that you have to walk around. And then if you need to use a walking device, making sure that you have the proper device and that you're using it inside the home as well as outside of the home. And most importantly, in addition to these environmental recommendations, getting on a regular strengthening and walking program is super important to making sure that your muscles are strong and that your bones and your joints is able to support the weight of your body when you're walking, because we not only have the weight of our body, we also have gravity pressing down upon us as well. Vision is something else that you can consider. So in addition to the things we talked about in the previous slide, if you do have vision problems, like macular degeneration, as your vision progresses, as far as the decreased ability to accurately see and tell different patterns and shapes, then making sure that you're using contrasting colors. So if you have a dark surface carpet or hardwood floor, then if you're going to use any type of rug on top of that, secured with the double-sided tape, you want it to be a lighter color so you can tell where that rug is. Also, there are color strips, non-slip color strips that you can place at the edge of the steps, so you can tell, that depth perception can be difficult for some people. So you can tell where one step ends and the other begins, and having them on your walker handles will allow you to be able to see where that device is in front of you. So, and if you're supposed to wear glasses or you have some other type of visual aid, of course, using them will help. And although, toothbrush holders and towels and all of that stuff, in the bathroom, things that you use there, even though that doesn't have anything to do with actually preventing falls, it's just something to help you be able to see those contrasted colors better, to know, where your towels are, where your toothbrushes are. So our balance approach, when I say our, I'm talking about New Direction Rehabilitation and Wellness. We look at the whole person, the environment, and we use those things to establish an individualized plan for that person. There is no one person's balance deficits that is alike. I could find that it is strength with that slow working vestibular system, or there's times when I find that there aren't any deficits in the strength, not enough to make falls an issue, but it's more of getting that vestibular system, our inner balance system, working at a faster pace. And I also do a walking assessment. You can tell a lot from someone and their balance and fall issues by watching them walk. And we take the environment, the throw rugs and the lighting, everything that I talked with you about in the previous slides, we take all of that into consideration as we are making the individualized plan for the patient. And we do education on, why certain things are a problem, let them know how they can fix it. But we also go over emergency planning. If they live by themselves and they fall, are they able to get up? Do you have an emergency call button? Do you keep your phone with you all the time? What are you going to do in the event that you fall? And we're going to talk a little bit about fall recovery training, which we do with some people. However, it's not appropriate for everyone. And what fall recovery training is it teaches you, or we teach you, how to get up off of the floor if you fall. And yes, we can verbally tell you how to do it, but getting people in that position to get up off the floor, actually going over that with them, has been so beneficial, and it empowers that patient to feel confident that, hey, if something happens, then I am able to get myself up off of the floor. So the people that it's not appropriate for is going to be those people where their muscle strength isn't strong enough to lift the weight of their body up off the floor. It could be maybe they have such severe arthritis that, the pain of getting them up off the floor by themselves, whether it's in their hands or in their knees, that's going to prevent them from getting up. So if there's something in a medical condition that I see that is not going to be appropriate to do that type of training with you, then we don't even try it. But that's where the emergency education comes in, letting them know about different things that they can do outside of, getting themselves up off the floor. And then if you are injured, if you've fallen and like you're hurting really bad, that you've injured your hip or injured something else, then that also is not an appropriate situation to try and get yourself up. So it is good to be able to have someone there with you in the home, or have those emergency push buttons or watches to be able to call for medical assistance. Why is getting people up off the floor, teaching them how to get themselves up off the floor, why is that so important? And, I've had conversations with clinicians, and some clinicians think that you should teach people how to do it, and some people don't. And my experience in treating balance and fall patients, if they are able to learn fall recovery training safely, it is important. And it's not the fall sometimes that causes the problems. It is the secondary injuries that from the falls that cause the problem. And I remember a lady that I saw when I was working in home health. She lived by herself. She didn't have family too close. And so they weren't able to check in on with her every day or often. And she fell and she could not get herself up off the floor. So she didn't break anything, but she had to be admitted to the hospital, not because of, a broken hip or something else. It was because she had laid on the floor for 3 days before anybody had came and saw that she was on the floor. And actually it was the home health nurse who ended up being the one to come and find her on the floor. But she had pressure sores from laying on the floor too long, and she was also severely dehydrated, because of course you can't get up, you're not eating, you're not drinking, your bodily fluids may be coming out. And so those are the reasons why I'm passionate about every aspect of fall prevention and recovery, because there's just so much there. There's so much there. And also it's important because it maintains a level of independence. So this particular client of mine, he has given written and verbal permission as well to show the video, but I still wanted to just kind of, shade the face a little bit. So he's 86 years old. His wife called me because he's an active person. He likes walking every day. They're out in the community, but he was falling so many times, like multiple times. And when I assessed him in the initial assessment, he was at a high fall risk. And she couldn't get him up off the floor when he fell. He couldn't get himself up. So you're calling the medical services, or a neighbor out that happened to be outside was able to help him get up at one time. And so we started therapy for balance training. And we saw that, there were some strength deficits. And once we were able to address those strength deficits, we were able to get into the balance activities that we needed to do. And when we finished, he was at a low fall risk. And I did 3 different tests with him because each of those tests touched different areas. And all of those were areas that he needed to be safe in the home and also be safe in the community. And between those 3 tests, he improved 43 points. I was so proud of him. He was so proud. I still connect with them to this day, and he is still doing great following the home exercise program that we outlined for him. So I want to show you what fall recovering training looks like. And this was only the 7th visit. And that was perfect because, again, he could not get himself up before, but just after the 7th visit, he was able to get himself up off the floor. We practiced in the living room. We practiced in his bedroom, in the bathroom. We did different areas in his home when he was able to do it safely. I'm able to assess that before we even get you on the floor. And he just did such an amazing job. And just the confidence that level that came to him and knowing that he could do it, but also the comfort that came to his wife, knowing that, hey, he will be able to get up off the floor. I can't physically help him, but I can, coach him through it, remind him of what to do, but him having the strength to do it, is phenomenal. So ask yourself these questions. This is a scale that I use with some of the clients, and really a lot of the clients who are still active in the community or they're trying to reintegrate to increasing their activity in the community. And you're going to think, how confident are you that you will not lose your balance or become unsteady? So, even a little kilter to the left, you're not going to lose your balance and fall, and you're not going to become unsteady. How confident are you? And you're going to use the scale from 0 to 100%. And you're going to give yourself a score. And based upon the score, it tells me, how much of a risk you are of falling. And it also tells me if you are at a score that you are considered to be safe to negotiate in the community. So if you look through this and you read it and you're having, some reservations about any of these activities, then it would be good to get a assessment performed from, a physical therapist, and to see exactly what is your fall risk and exactly what is your the deficits contributing to the fall. This is just a questionnaire, but as with the client that you just saw, there are many different tests that I like to use, and it's based upon what the individualized person, their activities and functional levels are. And those are the tests that we use to specifically identify certain things. And then my favorite question, even though this is not part of this ABC scale, is if you fell, could you get yourself up? And if there is any question about that, you don't even have to look at these other questions here at ABC scale. If you knew or had any question that you would be able to get yourself up if you were not injured, then you most definitely need to get a consultation from a physical therapist. I would love, and my therapists who work with me would love to come to your home and do the assessment with you there. It allows us to see your home environment, and it's also convenient. So there's our number. You have our email right there, and we will come to you. Give us a call, and we would love to do that. And I like to tell people that your decisions today is going to affect your independence tomorrow. So our company is not just about reactive wellness or reactive therapy, but we want proactive wellness. So we don't want you to get to the point where you're noticing a decline and, we're just ignoring it, and it gets worse and it gets worse. And now you've fallen and you have injured yourself. We don't want to see you at that point. We will see you at that point, but we all need to be more proactive in our approach to our own health and wellness. And if we're not on a strengthening program, we're not on a walking program, if we're in an environment that is cluttered and is not conducive to safety, then we want to change these things now in order to help prevent something adverse in the future. So thank you for joining me, and I look forward to hearing from you or someone that you know, and helping them improve their balance and maintain their safety and independence at home.